Assalamualaikum. My name is Nur Amila Fadina binti Nuruddin, Diploma in Medical Assistant. Today, I would like to present about ectopic in pregnancy. First of all, I will start about epidemiology, which is related to this case. In the past 2 decades, the incidence of ectopic pregnancy has doubled or tripled in many parts of the world. In France, ectopic pregnancy is currently for 2% of live birth and 1.6% of all reported pregnancies. This rate appears to be stable at this time. The main risk factor identified include pelvic inflammatory disease, which is mainly caused by chlamydia infection. More than 50% of ectopic pregnancy are caused by infectious factor, drinking alcohol and smoking, suggesting a dramatic effect on ectopic pregnancy. A third available risk is the induced conception cycle, especially by clopimine. Other than that, risk factor are pelvic surgery, previous ectopic pregnancy, and maternal age, which is especially over 35 years old. For the further epidemiology, is needed to identify new risk factor to monitor incident and rates the assess the impact of public health policies. Next we go to definition, which is ectopic pregnancy occurs when a fertilized egg implant and grow outside of the uterus, usually in one of the fallopian tube. Ectopic pregnancy most often occurs in the fallopian tube that carries the egg from the ovary to the uterus. The fallopian tube is the tube that connects the ovary to the uterus. If the egg gets stuck in it, it will not develop into a baby and health may be at risk if the pregnancy continues. Sometimes an ectopic pregnancy occurs in other areas of body, such as the ovary, abdominal cavity, or the lower part of the uterus, which is cervix, that connect to the vagina. I will move to pathophysiology. The trophoblast develop in the fertilization ovum and invade deeply into the tubal wall. The following of implantation, the trophoblast produce HCG, which maintain the corpus luteum. The corpus luteum produce estrogen and progesterone, which change the secretory endometrium into decidua. Other than that, the uterus enlarge up to 8 weeks and becomes soft. The tubal pregnancy does not usually proceed beyond 8 to 10 weeks due to lack of decidual erection in the tube, the thin of the tube, and the inadequacy of tubal lumen. Other than that, separation of the gestational from the tubal wall leads to its degeneration and fall of the HCG level, regression of the corpus luteum, and subsequent drop in the estrogen and progesterone level. Next is the structure containing the fetus usually rupture after about 6 to 16 weeks. Rupture result in bleeding that can be gradual and rapid enough to cause hemorrhagic shock and intraperitoneal blood irritates the peritoneum. The most common site of ectopic pregnancy is in the fallopian tubes, which is 80% ampulla. Other than that, the HCG levels in an ectopic pregnancy are usually lower than in uterine pregnancies. Okay, now I will go to the etiology, which is causes ectopic pregnancy can be in medical history, which is can be previous ectopic pregnancy, pelvic surgery, and endometriosis. Other than that, we have pregnancy after 35 years old, unhealthy habits such as smoking and drinking alcohol. Other than that, multiple sex partner, infertility, genetic abnormalities, and birth defect, pelvic inflammatory disease, which is PID, and the last one is had fertility treatment such as in vitro fertilization. Okay, after than that, I have a clinical manifestation that occur on the ectopic pregnancy. Okay, first, which is dizziness and vomiting, pelvic pain, which is sometimes cramps, and then vaginal bleeding, menses may be delayed or missed, and then a bad backage, pressure in the rectum and change in the bowel, sudden drop in blood pressure, and the last one is abdominal pain. Next, I will move to investigation that used to ectopic in pregnancy. First, use serum progesterone level, which is level less than 5 mg per ml, considered abnormal, and level greater than 25 mg per ml are a normally developed pregnancy. Second is pregnancy test. Third is pregnancy blood test, which is HCG. And the last one is transvaginal ultrasound, which is egg fertilized at fallopian tube. Okay, next I move to management. Use laparoscopic procedure, which is it used to treat some ectopic pregnancies. In this procedure, a small incision is made in the abdomen, near or in the navel. For the medication that can given is a single dose of methotrexate, 50 mg per ml. If all of the cases following are present, such as unruptured tubal pregnancies, less than 2 cm in diameter. No fetal heart activity is detected, and the last one is the beta HCG level is less than 5,000 per ml. Okay, next is surgery. Surgery that used is sapingectomy. It's a surgical procedure where one or both of a woman's fallopian tubes are removed. If the contralateral tube is healthy, the tube may be removed. Other than that is surgery sapingotomy. Is the creation of an opening into the fallopian tube, but the tube is not removed in this procedure. If the udder is damaged, then the incision into the tube to remove the pregnancy should be attempted. And the last one is emergency surgery. Last but not least, I will explain about the prognosis of this ectopic pregnancy. The ectopic pregnancy is typically present 6 to 8 weeks after the last normal menstrual period, but it can present early or late. Ectopic pregnancies is fatal to the fetus, but if treatment occurs before rupture, maternal death is rare. Other than that, in the US, ectopic pregnancy probably accounts for 9% of pregnancy-related maternal death. Alright, that's all for me, and thank you for listening my explanation or presentation for you. Thank you.
Binilah satu.